As we age, maintaining personal hygiene becomes more challenging, but also more crucial. Personal hygiene is not just about looking and smelling good. It plays a vital role in preventing infections, maintaining self-esteem, and ensuring a higher quality of life. Unfortunately, some older adults, often unknowingly, make hygiene mistakes that doctors and caregivers spot right away. These mistakes can be signs of underlying issues like cognitive decline, depression, or mobility problems. In this article, we explore 7 common personal hygiene mistakes among the elderly, why they happen, and how to address them effectively. 1. Infrequent bathing or showering. One of the most common hygiene slip-ups in older adults is infrequent bathing. Doctors often notice when a senior patient hasn't bathed recently due to body odor, dry or flaky skin, or visible dirt in areas like the neck, ears, or underarms. There are many reasons why seniors may bathe less often: fear of falling in the shower, physical discomfort due to arthritis or other conditions, or simply forgetting due to memory issues. Some may avoid bathing because they feel cold easily or find the task too exhausting. What to do? Install grab bars, non-slip mats, and a shower chair to make bathing safer and more comfortable. Consider using no-rinse cleansing products between showers. Establishing a regular routine or getting assistance from a caregiver can also help ensure that bathing becomes a manageable part of the week. 2. Poor oral hygiene. Dental care is often neglected in older age, yet it's crucial for overall health. Doctors and dentists quickly notice signs of poor oral hygiene, such as bad breath, plaque buildup, inflamed gums, or dry mouth. Seniors may struggle with brushing and flossing due to arthritis, dentures, or cognitive issues. In some cases, they might not see a dentist regularly due to financial constraints or transportation problems. What to do? Encourage twice-daily brushing with an electric toothbrush and regular flossing, or the use of floss picks. Keep up with dental checkups at least twice a year. If dexterity is an issue, a caregiver or family member may need to assist. Mouthwash and sugar-free gum can also help maintain oral hygiene and manage dry mouth. 3. Wearing the same clothes for days. Another hygiene mistake seniors make is wearing the same outfit for several days without washing. Doctors may notice food stains, musty smells, or signs of poor circulation caused by tight or inappropriate clothing. Seniors might wear the same clothes because changing is difficult, laundry is overwhelming, or they don't realize how long it's been. What to do? Help set up a simple system where clothes are rotated every day or two. Labeling outfits by days of the week or providing easy-access drawers can make the task simpler. Ensure laundry facilities are accessible, or arrange for laundry services if needed. Caregivers can also gently remind or assist with changing clothes. 4. Neglecting nail and foot care. Overgrown, yellowed, or dirty nails are signs doctors pick up on right away. Poor nail hygiene can lead to painful conditions like ingrown toenails, fungal infections, or even serious complications in diabetic patients. Many seniors neglect their nails and feet simply because they can't reach them or can't see the changes happening. What to do? Regularly inspect nails and feet for any changes. Schedule monthly foot soaks and trimming sessions, or book a professional pedicure. Medical pedicures are a safe option. Diabetics should see a podiatrist regularly to prevent foot ulcers or infections. Moisturizing feet and trimming nails properly can go a long way in preventing bigger issues. 5. Ignoring hair and scalp. Hygiene. Unkempt hair or a dry, flaky scalp is another red flag for healthcare providers. Seniors might forget to wash their hair, avoid it due to limited mobility, or have a hard time combing and maintaining it. For those with thinning or fragile hair, regular maintenance might seem unnecessary, but clean hair and scalp health are still essential. What to do? Simplify hair care with easy-to-use products like dry shampoo or gentle no-tear formulas. Make hair washing part of a weekly routine and invest in tools like long-handled brushes. For those with severe mobility issues, in-home hairstyling services or caregiver support can make all the difference. 6. Improper use of incontinence products. Incontinence is common among older adults, but it must be managed properly. Doctors often notice skin irritation, rashes, or a strong ammonia-like odor, signs that briefs or pads aren't being changed frequently enough. Sometimes the issue is embarrassment, denial, or lack of access to proper products. What to do? Choose the right incontinence products based on absorbency and comfort. Make sure they're changed regularly and that the skin is cleaned and dried thoroughly each time. Barrier creams can help prevent irritation. If incontinence becomes frequent, it's worth consulting a doctor to rule out treatable causes like urinary tract infections. 7. Overuse of perfume or scented products to mask odors. Some older adults may try to cover up hygiene issues with strong perfumes, colognes, or powders. While the intention is understandable, this can sometimes signal poor hygiene practices or lack of awareness. Doctors and caregivers can usually tell when these scents are masking body odor rather than complementing cleanliness. What to do? Focus on establishing a real hygiene routine rather than masking odors. Light, unscented moisturizers and gentle cleansers are better for aging skin. If memory is a factor, caregivers can help by creating a checklist or schedule that includes bathing, deodorant application, and dressing. Why these mistakes happen more with age. It's important to approach these hygiene challenges with compassion and understanding. There are many reasons why older adults may struggle with personal care. Mobility issues, arthritis, osteoporosis, and general frailty can make bending, lifting, and standing difficult. Cognitive decline. Dementia or Alzheimer's can cause seniors to forget their routines or misunderstand social cues. Depression or isolation. Seniors who live alone or feel disconnected may lose motivation to take care of themselves. Medication side effects. Some medications can cause fatigue, dizziness, or other symptoms that make hygiene more difficult. Fear of falling or injury. Many seniors avoid showers or baths due to fear, especially if they've had a past fall. What doctors really see. When doctors spot these hygiene mistakes, they're not just seeing surface-level issues. They often interpret them as clues to deeper problems. A senior who suddenly appears unclean might be dealing with memory loss. Someone who refuses to shower could be depressed or in physical pain. These signs help doctors understand a patient's daily living capacity and whether additional support is needed at home. Doctors may use these observations to initiate conversations about safety, in-home care, or lifestyle changes. They might recommend occupational therapy, suggest tools like grab bars or long-handled brushes, or refer patients to specialists who can help manage the underlying issues. How caregivers and family members can help. If you're caring for an aging loved one, it's important to notice hygiene-related changes early. Approach the topic gently and respectfully, never with shame or criticism. Instead of saying, "You smell bad," try, "Let's freshen up together." It'll help you feel more comfortable. Encourage independence, but step in when assistance is clearly needed. Setting up a structured hygiene routine, investing in adaptive tools, and offering emotional support can make all the difference. Some seniors are more receptive to care when it comes from professionals, so don't hesitate to involve visiting nurses or aides if needed. Final thoughts. Personal hygiene is a sensitive yet critical aspect of aging that too often gets overlooked. The 7 common mistakes discussed here, like skipping baths, poor dental care, or neglecting nails, aren't just aesthetic issues. They can affect physical health, mental well-being, and even the ability to live independently. Doctors notice these signs immediately, not because they're judging, but because they understand the wider implications. If you or a loved one is struggling with hygiene, know that support is available. By making small adjustments and building healthier routines, it's entirely possible to maintain dignity, cleanliness, and confidence well into the senior years. Thanks for watching. Please subscribe our channel.